Hey guys, Dr. Angelina with SurgiCare Arts and IBI Healthcare Institute. This video is about Semaglutide, the weight loss shot that I've been posting about, and I know a lot of people in the country have been talking about. This is one of the more common medications nowadays for weight loss, and I truly believe in it. This is out of, how many years I've been in medicine, first medicine that I truly see the results from, okay? There are always phentermine programs in the past, they still have them. Phentermine is good for a couple of months and then it's really bad for your heart. And it also gives you short-term result. The moment you stop phentermine, you regain the weight back, right? Plus a little bonus. This medicine is meant to be taken long-term, and so there's no side effects of taking it for longer than 3 to 6 months like phentermine. It will not have side effects like those other medications that we've had available in the past. So do I prescribe phentermine now? Occasionally I still do, but my goal is always to either eventually transition to semaglutide or just start with semaglutide this day and age, just because it has better results with less side effects. Semaglutide, known by commercial names as Wegovy or Ozempic. Ozempic is for diabetic medication, for diabetic patients. Wegovy is for weight loss patients, but they're both semaglutide. It's the same medication. In my office, we offer generic form of it under the name of SlimMed because the commercial Wegovy is just not available in a pharmacy. So again, even if you wanted to pay $1,700, that's how much it costs in a pharmacy. You can look at in GoodRx, you'll see Wegovy comes up under about that price. It's not available. So I had no choice but to get the generic into my office, and that's what I give to my patients. This program basically includes your monthly supply of medication, 4 shots, you give it yourself once a week, and of course access to us for any questions and problems that you may have regarding this medication and the weight loss program. I do like to combine it with intermittent fasting. It's one of those common questions we have. Are you going to make me exercise? Are you going to make me do this? I cannot make you do crap, sorry. I can recommend things, and I can recommend for you to live a healthier lifestyle. I can recommend for you to do intermittent fasting while you're taking the medicine. Intermittent fasting is not starving. Let's make it very clear. A lot of people who don't understand intermittent fasting keep hearing the word fasting, so they think you have to kind of starve yourself. You don't. You just don't have to eat like a cow and graze 24/7. And I don't call my patients cows. My patients who know me, they understand this. What I meant is we don't need to be grazing. We don't need to chew something 24/7. It's very common in our culture for people to wake up early in the morning to go to work, start eating at 6, 7 in the morning, and they have a snack at 10, they have lunch at 12, they have another snack at 3, because that's what they teach us in school, right? My kids always have to have a snack, we have to have a snack. You don't. Dinner at 6, 7, 8, 10 p.m., and then midnight snack again because we have the craving. So we end up literally grazing and putting calories in our body almost 24 hours a day. Intermittent fasting means you choose a window of about 6 to 8 hours, and that's the window you're going to choose to where you're going to put your calories in. The rest of the 16 to 18 hours, minimum 16 hours, but I prefer 16 to 18 hours, is where you're not going to put calories in your body. You can drink all the water in the world during that time. You can have a cup of coffee in the morning when you wake up with a splash of milk in it or cream without added sugar, or a cup of tea that has no calories in it, right? So you can have that in the morning. That doesn't break your fast. It doesn't count. You may start eating, let's say, at noon. You can have your lunch, breakfast, brunch, whatever it is at noon. Have at it. Do whatever it feels like. And you might be starving. You might say, well, I'm taking this medicine, it's supposed to make me not hungry. Why am I starving? You haven't had anything to eat for 18 hours. That's okay. It's okay to have the feeling of starvation, that you're hungry. Go eat something. That's going to be a good time. At noon, let's say, you're going to go have something to eat. And then your next meal might be what? If your breakfast is at noon, your lunch will be at 3. And at this point, you might not be hungry at all. And you're like, okay, I'll have a banana. That's your lunch, fine. And then you come home after work, and maybe you're going to eat with your family at 6 or 7 p.m. So now we created this window where you put all your daily calories into that short period of time. it might take a few days. It's not going to happen overnight. It might take a few days for your body to realize, oh, this is working. I'm not trying to eat something first thing in the morning and just munching something all the time. And then whenever you decide to eat, whatever you're eating, that's your meal. I don't want snacks. So if you feel like I want this, I want the apple, I want orange, I want a cup of soup, I want a sandwich, fine. Put it all together. This is your meal. Sit down and eat it all together. Don't try to have a little snacky here and snacky there. I want you to separate your calories into like categories. 2 or 3 meals a day is okay. For me, I often end up having just 1 meal a day, because if I'm in surgery all day, had my cup of coffee in the morning, I'm in surgery all day, I really don't get to eat until later afternoon, maybe 3-4 p.m. And then I get home at 6 and I'm like, well, I should have my dinner. I just had my little breakfast, whatever it was, at 4 p.m. Don't really feel like dinner, so I might have a cup of coffee or tea or whatever I can drink at that time of the day. And again, water throughout a day. So again, SlimMed, that's a shot once a week. Intermittent fasting combined with it, if at all possible. And again, don't get too paranoid about it. It's okay if one day you had breakfast. It's okay one time you went out and you had something with your friends late in the evening. It's okay. But if you know this is happening, you can try to prepare yourself. Okay, I'm going to be eating very late tonight, going out, Saturday night, whatever. I'm not going to have my breakfast until later in the day to move that window as far south as I can. That way you're, again, not grazing all day long. So once you kind of figure that out, you can change that window. One day it could be a whole day window. One day it could be a shorter window when you put the calories. Drinking water is very important. We cannot really burn calories or get rid of fat if you're not drinking water. I don't care if it's sparkling water. I don't recommend flavored water, because unless you're just doing natural flavors like infused water or squeezing some lemon or lime into it, I don't want this fake sugar waters. Those are not good. And then exercise, of course, is good for you. I mentioned in my previous videos, do what you can, because I want it to be a lifestyle. I'm not saying not to eat carbohydrates. I'm not saying not to eat any particular food group. I say use healthier choices if you can. Stuff that you cook yourself, not the things that come out of the bag. Those usually have much more salt and preservatives added, and they are processed foods, and we don't want those. So we want to go as natural as we can, whenever we can. Hope this explains a lot. During consultation for this medication, you will be asked quite a few questions about your medical history. So again, we'll be asking your height, your current weight, your highest weight, your goal or happy weight. We want to find out if you had previous surgeries, especially weight loss surgery. I want to find out if you had previous medical conditions like pancreatitis or medullary thyroid cancer. I would want to know if you're diabetic or taking medications for it, and any other medications you're taking, because again, this is a prescription drug. We need to make sure it is correctly prescribed. And it's nice to know if surgeries, complications. Basically, we need to know you and know your history. Based on that, we'll be able to recommend the medication. Once you get it, again, in my practice, we don't have any fancy injector pens, but we're saving you over $1,000. Again, in pharmacy, Wegovy is about $1,700. Most insurances don't pay for it, and currently it's not available even if you wanted to. In my office, it comes in thing like this. Small little syringe. Usually we use the syringes for Botox or insulin or other medications like that. It has tiny syringe. So if you are afraid of needles, don't look, because I'm going to give myself a shot now. You can barely, let's see. Can you kind of see it? Yeah, there you are. A very small, tiny needle. So this is the medicine. I pick up whatever you can pick up. You can do it on the belly, you can do it on the thigh, whatever you have, some extra grabby stuff. You take this little needle, you go straight in. Straight in. You don't want to do it sideways or anything like that. Push it all the way in. The faster you do, the better. See, I'm all the way in, I'm still pushing, and then you push the plunger. Take it out. Okay? So, really nothing to it. I was doing it slower than I normally would because I was showing you. But basically, again, you grab a little roll of something, you go straight in, perpendicular, and then push. Store it in the refrigerator for the rest of the time. And for people who are afraid of needles or cannot give themselves a shot and you live nearby, you can always come to the office once a week to receive your shot. That's okay too. My office will work with you and to accommodate you and make sure that you get good results. As I mentioned earlier, it's a slower onset medication. I don't expect you to lose all your weight in the first month. I don't want you to get disappointed. It might take 2-3 months to get to the mode of losing weight. So I have people who don't lose anything first 2 months, but then they lose 20 pounds on the third month. And I have people who lose 20 pounds in the first month as well. So different medication activity, it affects you differently because you're an individual and your body didn't read the book, right? So everybody's gonna react slightly differently. But at the end, 6 to 12 months, I feel like I haven't had anybody who has not lost weight. Again, if you commit to this medicine, I do ask you to commit to it for 6 to 12 months. After that, we can look and decide, okay, how's it going? Are we where we want to be? Is there more weight to lose? Do we need to stay on it longer? Or we're at the goal weight and we're gonna start maybe just using it for maintenance alone and changing how we're giving it to you. So that will come once we get to a certain goal. In my office, if you have any questions about this medicine specifically, you can email to slimmed@georgiasurgicare.com or slimmed@IBI Healthcare Institute. Those links are available on the website, and usually that's the email that you will get a response from my office. You always go to our website, SurgiCareArts.com. Watch this video. I hope this explains quite a bit. Other questions people ask about side effects. Again, the most common side effects of this medicine in the beginning is a little bit of nausea. For women who had kids before, it's a little bit of that pregnancy nausea, tiny bit. Usually it goes away pretty quickly. It might happen with each additional dose increase, just kind of like a little bit of that discomfort. Usually just hold off on eating completely or drink more water, and usually that cures it. But again, if you're not eating, that kind of is the goal. Also, feelings of heartburn or super fullness, again, that's what medicine is doing. It's making your brain believe that you overate, so you don't eat anymore. If you're having heartburn or that weird fullness feeling, just don't eat. Give it some time. Don't go lay down flat. Drink some water or hot tea. That usually helps to kind of wash down some of that feeling. That's been helpful. If it's really bad and it's consistent, you can let me know. We can always prescribe medications for nausea, but I so far maybe had only one patient who needed that, hundreds that had this medication. Contact at SurgiCareArts.com or SurgiCare Arts on Instagram and let us know what you think. And if you have any questions, then we'll go from there. Hope this helps.